All right, let's dive in. Today, we're tackling a really important topic, parental vaccine hesitancy. It's something that connects global health, the safety of our communities, and of course, some very personal choices. We're going to start with the big, worldwide picture, and then we'll zoom all the way into the one-on-one conversations that might just be the key to moving forward. Let's get to it.
So, let's just start with a question that gets right to the point. Why are diseases that many of us thought were history, things like measles, suddenly popping up again? What is going on? Well, the answer is complicated, but a huge part of it points right to gaps in our community immunity.
And if you want a number that'll really make you sit up, look at this. In just the first few months of 2024, the U.S. saw measles cases jump 17 times higher than the average of the past few years. That's not a small bump. That is a massive, flashing warning light.
And this isn't just happening in one place. A drop in vaccination rates in one community can create ripple effects around the globe. So first, let's unpack this as the worldwide challenge that it is.
The World Health Organization called vaccine hesitancy one of the biggest threats to global health. But check out the year, 2019. This was a major concern for them long before the pandemic. It's a problem that's been building for quite a while.
And this isn't just a theoretical threat. You can see the real-world impact right here. Back in 2018, Europe had this devastating measles surge. We're talking over 160,000 cases and more than 100 deaths. And it happened because vaccination rates in some communities just dipped below that critical level needed to keep the virus in check.
So you have to ask, right? If the consequences are so serious, why are people hesitant? To really get it, public health experts came up with this really helpful framework they called the 3 C's, and it helps break down all the complex reasons people might pause.
But before we jump into those, let's just be super clear on what we mean by hesitancy. It's not a simple yes or no thing. The WHO defines it as a delay or an outright refusal, even when vaccines are ready and available. It's really a spectrum.
The first C is confident, and this one is all about trust. It's trust in the vaccine itself. Is it safe? Does it work? But it's also about trust in the doctors, the nurses, and the entire public health system that's recommending it.
And confidence is a fragile thing. It can be worn down by fear of side effects, what experts call AFIs. It's also battered by the constant storm of misinformation online. And for some communities, there's a deep and frankly justified distrust that comes from historical injustices in medicine.
Okay, the second C is complacency. And this one's a little strange because it's a paradox. It's basically a side effect of vaccines doing their job incredibly well.
I mean, think about it. Because vaccines have been so successful, most of us have never personally seen the awful effects of diseases like polio or measles. And because we haven't seen them, the risk doesn't feel real. And sometimes the vaccine itself can start to seem scarier than the disease it protects you from.
And that brings us to the third C, convenience. Because even if a parent has total confidence and feels the urgency, sometimes life just gets in the way.
We're talking about all the practical day-to-day stuff. Can you actually afford the copay? Can you find a clinic that's open outside of your work hours? Do you have transportation to even get there? For so many parents who are willing, these hurdles can make it nearly impossible to get it done.
Okay, so we've covered the why. Now let's zoom in from that big global view and see how these things are actually playing out right here in the United States, with some real numbers and real costs.
The trend is pretty clear. More and more parents are opting out of school-required vaccines for non-medical reasons, and the numbers have hit a historic high. Now, 3% might not sound like a lot, but here's the thing. These exemptions often cluster in the same communities, creating these vulnerable pockets where our collective shield has dangerous gaps.
And it's not just about health. There's a huge economic side to this. Over a 20-year span, routine childhood vaccinations generated an incredible $2.7 trillion in societal savings. On the flip side, just a 5% drop in measles vaccination could cost the public an extra $2.1 million every single year.
So if the stakes are this high, what do we do? Well, the answer might be less about new rules and more about changing the actual conversation. So let's zoom in one last time, down to the level of a single chat between a healthcare provider and a concerned parent.
You've basically got 2 ways to approach this. On the left is the traditional way. I'm the expert, here are the facts, this is what you should do. But a lot of the time, that just makes people dig in their heels. On the right, you have something totally different, motivational interviewing. It's not about being an authority, it's about being a partner. It aims to understand a person's values before it even tries to offer information.
See, this approach isn't about winning a debate.
It's built on 5 core techniques that are all about creating a real dialogue. You start by inviting the parent to share what they're thinking. You affirm their good intentions. You show you're listening by reflecting their concerns back to them. And only then, after asking for permission, do you share information, all while making it clear that the final choice is theirs. Let's see what a few of these look like.
It all starts with open-ended questions. See how this is so different from asking, "Are you going to vaccinate?" This question is a genuine invitation. It opens the door to a real conversation instead of just looking for a yes or no.
Next up, you offer affirmations. Now, this isn't about agreeing with their specific concerns. It's about validating their intention. A simple sentence like this says, "I see you're a good parent who's trying to do the right thing." And that can help lower their defenses and build trust.
Then you have reflective listening. This is where the provider shows they are truly hearing that specific fear. By saying it back in their own words, it confirms that they understand, and it makes the parent feel seen and heard, which is absolutely essential. Now, crucially, before sharing any facts, the provider would ask permission, something like, "Would you be open to hearing about?" That simple step changes the whole dynamic from a lecture into a partnership, and it all leads to empowering their autonomy. This final phrase reinforces that the provider is a guide, not a boss, respecting that the parent is the one who makes the final call.
Which really leaves us with a big, important question. If just presenting facts isn't always enough to bridge the gap, could empathy be the real solution? We've seen that hesitancy often comes from complex emotions, fear, distrust, confusion. So maybe the most powerful tool we have isn't a better statistic, but a better conversation. Thanks for joining this explainer.